We have a group of very distinguished people sitting toward the front that I'd like to introduce to begin. We have, of course, our senior United States Senator Jay Rockefeller. To his left is Dean Charles McCown, who's the Dean of the Medical School here at Marshall. To my right, we have George Washington, or Glenn Washington, I'm sorry. No pun intended, Glenn. Representing Cabell Huntington Hospital, Angie Swearingen, representing St. Mary's Hospital, and Larry Malone, representing the West Virginia Telehealth Alliance. It's great to have you here. We also have a distinguished panel down here of partners who are part of this project, and we welcome the members of the Telehealth Alliance. We also welcome Mayor of Huntington, who is with us today, and if we have any members of the West Virginia legislature here today, we welcome you as well. We certainly welcome all of our guests here, especially our medical students and residents and interns who are here with us, as well as our attending staff. This project is extremely meaningful to you and your futures. We have a very important announcement today of a project that's long in the making. And if you turn the clock back some 5 years or so, one of the foremost and most important questions I asked Dr. Jan Fox when I first came here as president at Marshall was, do we have Internet 2 connectivity at Marshall University, and if not, what do we need to do to get it? And then secondly, what do we need to do to build the cyber infrastructure of this community and this region of the state to be able to be competitive in the global marketplace and also to be able to serve all of the constituents that we are expected to serve, which includes the medical centers and healthcare providers of this region and throughout the state. If you look at the first slide here, you'll see a project that began in 2007 through the leadership that Senator Rockefeller has provided, which is a blueprint for a nationwide telehealth connectivity project for broadband. It would start out as a rural healthcare pilot project, and all of the arms of this highlight what was envisioned at the beginning. If we focus in on West Virginia, some very, very important transitions have occurred. If you look at this area right in here, and this was something that Jan and I talked about, which is very, very critical. You'll notice the state of Ohio has kind of a cloverleaf pattern here, which is a series of redundant backbones for the fiber connections. Those redundant backbones are absolutely essential to ensuring the integrity of transmission in the event that there's a disruption in one location. If there's a disruption here, it still can operate. And that was very, very critical to our planning and thinking through what was going to be necessary. And this has, of course, taken place in collaboration with the Telehealth Alliance. Huntington and this part of the state and Marshall University and our partners are very, very well positioned in this national grid as a result of the initiatives that have taken place. When we look at 2007, there were 69 applicants who were funded through the federal government with $417 million to begin the development of this comprehensive program. The Metro Fiber Build Project received $800,000, and Senator Rockefeller was very, very instrumental and led the way in capturing $8.4 million in broadband support for the development throughout the state. And as you look at this, we're seeing the fruits of both the leadership and the vision that has led to this development. The goal is to catalyze broadband infrastructure development throughout the nation, and especially the design and development of a rural telehealth broadband network that will serve rural communities throughout the nation and under Senator Rockefeller's leadership, especially throughout the state of West Virginia, which is essentially almost an entirely rural state. The idea of high-speed bandwidth, go to the next slide, you can see the different, what's planned here in Huntington. This was the original template. You see the ORNet, which is coming out of Ohio, that connection to Internet 2. The red characters here, the lines, are the new fiber that was planned. The green was the existing fiber at Marshall University. And in a sense, what we've created here is a redundant backbone in the greater Huntington area that connects to a redundant backbone through the state of Ohio. The next slide gives you some sense of appreciation for what this kind of connectivity does. The Huntington Metro fiber links produce instantaneous transmission of high-density data sets that we're showing here with images. These are either CT or MRI images, and if you have a regular connection, it can take up to hours to have that transmission take place. The next slide shows an ultrasound transmission, and you see it's essentially instantaneous, whereas if you're on a regular connection, it's far, far slower, and that is one of the great benefits of this technology. There are other benefits as well, and they deal with vastly improved access in remote areas to quality medical care and patient services. It involves improved patient access to specialty care and specialty consultations. They involve real-time remote sensing and monitoring for critically and chronically ill patients at far lower cost to have this type of capability once the entire network is fully developed. This project is a very futuristic project, and it took leadership in Washington at the federal level to realize the benefits and to advocate and successfully lead the development of this type of technological advancement. And I'd like to introduce at this time Mr. Larry Malone, who is the Executive Director of the West Virginia Telehealth Alliance, who will talk to us briefly about the Alliance and its goals and how it fits into this larger configuration. Larry?
Thank you, President Kopp. On behalf of the Board of Directors of the Telehealth Alliance, I am very pleased to be here to be part of this announcement and to discuss the vision and the future that these improvements will provide for telehealth and for rural residents throughout West Virginia. As I mentioned, I am the chairman of the West Virginia Telehealth Alliance. The Telehealth Alliance is a nonprofit organization that involves the entire healthcare industry here in West Virginia, from the medical schools to the major hospitals to rural healthcare centers to free clinics and also a variety of other groups trying to advance healthcare in West Virginia. They all have come together because they realize the benefits that telehealth will provide in improving healthcare delivery throughout West Virginia. As Dr. Kopp mentioned, one of the major projects that we've been undertaking for the past several years is the implementation of the FCC's Rural Healthcare Pilot Program. The Alliance was fortunate to be one of the programs that received federal funds as part of this FCC initiative, thanks to the efforts of Senator Rockefeller. We are a statewide project. We're one of the few that received funding to do telehealth improvement throughout the entire state of West Virginia. The funds that we have received, which are $8.4 million in federal FCC funds, are being targeted primarily to improve telehealth opportunities and broadband connectivity in rural areas and medically underserved areas, which encompasses most of West Virginia. Those funds are to help spur the development and integration of networks so that these networks can share information and be prepared for where the future is going. That future is going to include the exchange of electronic health records, which is another major initiative underway here in West Virginia, but also another major initiative being fostered by the federal government and through the funding of the federal government. These improvements that will be made, such as the Metro Fiber project that we're here today to dedicate, will facilitate much improved broadband connectivity to rural healthcare centers and rural hospitals throughout West Virginia that will provide for telehealth opportunities. And those telehealth opportunities include not only the ability to do remote diagnosis and monitoring of rural patients with their primary care doctor, and the connection back to a specialist at a school of medicine such as here at Marshall or at St. Mary's or Cabell Huntington or WVU or CMC or other major institutions. But it also will provide, in certain instances, that if a trauma situation exists or an emergency situation exists in one of these rural centers, that person will have access to a specialist who may actually save their life that would not be available in that rural area. And that's the vision. That's what this is all about. It is about technology. It is about other opportunities, but it's really about improving the ability of rural residents to take advantage of not only the knowledge and the skills that exist in these major hospitals, but also in the ability for them in situations to possibly have life-saving procedures provided to them, or the information provided by neurologists to help when someone's presenting at a stroke, whether it's in Lincoln County or in Webster County. So I'm just very pleased that the Alliance has had the opportunity, thanks to the federal funding, to help facilitate this throughout the state of West Virginia. This also is a perfect public-private collaboration that I think is a way to help us solve more of our problems. I think working together, bringing people together is a way to address some of the major health issues we have in this nation and this state. There are some members of our board here today that I'd like to recognize. Our board of directors, which are 9 individuals from throughout West Virginia, have put in an enormous amount of time and energy into this project over the past couple years. I'd like to recognize Jim Krantz with the West Virginia Hospital Association, Dr. Arnie Hassan with the West Virginia School of Osteopathic Medicine, and Jerry Richey, who are here with us today. There are also some partners here with the Alliance that are with us today that I want to recognize. These partners have provided substantial resources to help the Alliance with the work that has gone on and the specialty services that we have needed. That includes Sonia Chambers, who's in the back with the Healthcare Authority. Sonia helped provide a significant grant to the Alliance, which was very important to us. Also is Nancy Sullivan, who's here today representing Secretary Mike Lewis with the West Virginia Department of Health and Human Resources. Nancy, we've appreciated the support that the department has provided us throughout this program. Last but not least, I want to make a comment and thank Senator Rockefeller personally. We came together several years ago to make this announcement up in Morgantown when the funding was first announced. I made a pledge that we would get this accomplished, and we are getting it accomplished, Senator, and it's a great pride for me and the other board members to be able to say that this project is becoming a reality and your vision is coming to be here in West Virginia. So on behalf of the Alliance, I'm just pleased that we're starting to realize and provide 21st century broadband connectivity for our healthcare industry here in West Virginia. Thank you.
Thank you, Larry. Congressman Rahal could not be with us today, but he sent a letter and asked that we read the letter at this auspicious occasion. He says, "Dear friends, healthcare access and delivery are the basic building blocks of any sustainable and successful economy. But distance still equates to money and time people have to expend. Put simply, all of us are far more likely to see the doctor if only it's convenient. All the traditional infrastructure we can muster with modern transportation cannot put a medical specialist in everyone's backyard. Technology can. Lastly, hats off to Huntington on the strides we are making with nutrition, wellness, and preventative care. These change agents are as critical as any for us, especially for our young as we encourage the habits of long and productive lives. It is my hope that they can be incorporated fully into this mission. I congratulate you, Senator Rockefeller, on your vision and handiwork in helping to deliver with my support the U.S. Department of Commerce funding that is fueling this mission. To each of you who have contributed to today's successful launch, blue skies are ahead. To everyone, as always, go herd. With warm regards, I am sincerely yours, Nick J. Rahal, II, Member of Congress." And we thank Congressman Rahal for that letter and his support. It's my pleasure at this time to introduce somebody who really doesn't need an introduction, but I think it's important to frame the context of his contributions to today's event. Senator Rockefeller is the prime mover, as well as champion and leader, who has ensured that rural states like West Virginia have access and can fully participate in broadband technologies as part of the nation's developing speed of light broadband telecommunications grid. In 1996, Senator Rockefeller was responsible for initiating the E-rate program that provided affordable access to these technologies to schools and libraries at an affordable level. He long ago recognized the dramatic impact that these technological capabilities will have on the lives and health of our residents. He appropriately regards broadband as the next crucial infrastructure challenge facing West Virginia and our country, and he clearly recognizes its vital role in the state's economic future. Senator Rockefeller passionately believes that broadband is as essential to our nation's infrastructure development as our water, sewer, and highway systems. The project he is about to unveil has tremendous strategic and applied implications for education, for research, and clinical care in our community and throughout the entire region. The purpose of the development of this national health network, telehealth network, is to enhance healthcare delivery to rural, medically underserved regions using telehealth and telemedicine technologies and capabilities. It will reduce costs. It will help foster greater use of electronic medical records, as Larry mentioned, and aid in improving the collection, analysis, and translation of public health care data into intelligence that can be used to advance patient care outcomes. We all owe this man an unending debt of gratitude. I give you Senator Jay Rockefeller. Senator. It does. Thank you for the reminder.
Thank you. My life has been made happy. Oh, in other words, you pushed the 6'5" button.
That's right.
And it went up. See, technology is everything. Can you hear me? I'm looking particularly at the medical students and probably some professors and all of you up there, as well as everybody here. And I'm saying to myself, with all of my heart, that this is the future of healthcare that we're talking about today. It really is. From your point of view, you know, what frustrates you and what will frustrate you, unless we can get this moving fast enough, is paperwork. You go crazy over paperwork, right? Nod your heads and I'll feel better. Okay, you don't like rules and regulations, but you really hate paperwork. And what we're talking about here is a way to, together with the healthcare reform bill, which is just passed, in which there's a tremendous amount of money for getting rid of paperwork and getting into a health IT environment just automatically in this country. And frankly, sort of catching up to the Veterans Administration. You know, I mean, they don't have paperwork. The private American hospital system has a lot of paperwork. The VA doesn't have a lot of paperwork. The Department of Defense has a lot of paperwork. You know, it's just interesting the way it divides out, but it's not impossible to do. And what we're talking about here today are some ways to do it. So, Mr. President, I appreciate very much your introduction. And the Telehealth Alliance, Larry, Capitol Huntington, St. Mary's, all of you. I really believe in high-speed internet. Internet was sort of the whole business. Really, there wasn't much of an internet really until what, the late 80s? Early 90s? And then the question was, as the president showed, it was extremely slow. And if you're a patient and you're being monitored, as this program will show, by somebody here at this center or at St. Mary's or whatever, the degree of speed with which you can transmit an X-ray is everything. One, because you keep the attention of the physician or the pediatric specialist or whatever. And secondly, you get it done faster and you get results faster. So the whole point of this is that you can be a rural West Virginian and you can be a very, very rural West Virginian, but you will have access, and now do have access, to almost 100 rural health centers. Those rural health centers will be connected in this program up to a way of you as a very rural person, maybe with a childbirth problem or some other kind of a problem, mental health problem, because you can do that too. It's video, voice back and forth. You can go to a rural health clinic and then you can be in conversation with a specialist right here. And that's extremely important. It's the way healthcare has to work. You cannot put a hospital in every county. Hospitals in counties, rural counties, are suffering enormously. They don't have the specialists that are increasingly required, but you have them in the main medical centers in West Virginia and throughout the country. So I came here as a social worker, so obviously I care very much about people in rural areas having access to really good health care because they get very desperate. They never see a doctor. They have never seen a doctor. They've never seen a dentist. Sometimes they've never seen a school bus. That's a different story. But they need the attention. They're people just as same as anybody else's. You know, we divide, I think, too much in this state and in America, and I see it up in Congress, and it's not a pretty sight. People like to take off after Medicaid. Medicaid's the largest insurance program in America. It's larger than Medicare. And 50% of all babies in West Virginia are born via Medicaid, paid for by Medicaid. So are we going to make a decision that the 50% who are born under Medicaid, babies don't have a lot of choice in that, do they? That somehow they don't merit the attention that those who can afford not to be born under Medicaid, and you can't make that distinction or else you're going against sort of the will of nature. And it's a moral indiscretion from my point of view. So increasing high-speed internet access to businesses and to families. This is not just healthcare we're talking about. I mean, I'm going up to the Dow Research Center right after this, and we're going to have a meeting which is having all to do how are we going to get much more high-tech businesses into West Virginia. And we can do that. There are unbelievable high-tech businesses that I haven't even heard of. And I thought I was meant to know that, and I am, but I didn't. There's some on that list that I didn't know existed. They depend on high-speed broadband. So this is the whole world of broadband, which we sort of started back in 1995 and have been pushing ever since, now getting up to G4, G3, G4. To really super high-speed internet is absolutely imperative. So, so the first announcement is that nearly 100 healthcare locations across West Virginia will be receiving improved and upgraded high-speed internet from the Federal Communication Commission's Rural Healthcare Pilot Project, which will connect them to each other. Connected to each other, connected to hospitals, and therefore able to do things which they've never been able to do before. And I'm so happy about this. So what does that mean for you? It means a great deal. Soon, West Virginians from all over the state will be able to get the medical expertise they need from doctors who they never see and don't need to see necessarily. But they're doctors just as if they were doctors sitting in the same clinical room with those patients. And they don't have to leave their communities. Let's be honest about it. A lot of people in West Virginia are scared of health care. You know, they have enough bad news in their lives. They don't want to go get some kind of a test which might reveal there's some more bad news in their lives. And so the whole thing of making health care more friendly, the access to health care more friendly, more a warmer experience, but a very decisive experience, is part of our obligation. We have a lot more small communities in West Virginia than we do large communities, that's for sure, and these people need that. Now, this is especially true for cardiology, for pediatrics, and for radiology specialists, which are only located at certain specific hospitals in West Virginia. 3 places to cover an entire state, if you want to make the connection with them, which we'll be able to do. Intensive care physicians and nurses will be able to monitor critically ill patients around the clock using video conferencing. If somebody has a mental health problem, and 10% of all Americans do, adults, kids, they have those. It's sort of a hidden subject, but happily it's getting less hidden and more out in the open. They can go and do this on this video, fast video, because it'll be voice. So they can see the person, talk to the person, listen to the person, and have consultations with that person with mental health problems also. Now that's not pediatrics, but that's pretty basic stuff, and it just shows the range of what we're talking about. So right now, if somebody in Pocahontas County, and I'm partial to that because I have a farm there, and if they face a medical emergency such as a heart attack, it will be absolutely impossible to get them to a facility. I mean, I respect the Pocahontas County Hospital, which was entirely built out of wood. Now there's a new one. I respect it, but they cannot attract, there only being 5,000 or 6,000 people in the county, they cannot attract specialists. They cannot do it. They'll never be able to do it. You can lay $100 million in front of them. Well, that might do it, but otherwise it won't happen. So rural health clinics throughout the state will be able to connect immediately to larger hospitals to access that specialty care that they need. I think that is wondrous. And I know that's the future of healthcare. Additionally, high-speed interconnection between rural health clinics and hospitals will also improve, and this I care a lot about, for pregnant women facing high-risk pregnancies. Now, that's pretty common. That's pretty common. Or even if they're not, some people think they are facing that. So it's the actual plus the imagined, and so we better know the difference. Or maybe there isn't a difference. As recently as 2007, the only board-certified obstetric specialists in West Virginia were located, guess where? Charleston, Huntington, and Morgantown. There were none other in the state. There are none other in the state. So you want to connect with them, then you've got to get on this interconnection system that we're talking about today. Women and babies needing the services of high-risk specialists often have to travel long distance. Well, they don't want to travel long distances. It's an easy thing to say if you're from Oklahoma. It's a tough thing to say if you're from West Virginia. You want to go 40 miles? Well, 40 miles, to some place that has one of these specialists, that may be a 3-hour trip, depending upon, like, the truck accident, which I had coming down to Huntington this morning. So this program will enable expecting mothers to receive the care they need from almost anywhere in the state, and that is a glorious and marvelous matter. I love that. I love the implications of that. This program is the future of our healthcare system. I believe that. And it's technological. But it isn't just technological. It's technology making all of you available to the people. And therefore, it's old-fashioned medicine, too. I mean, old-fashioned in a good sense. It's classic medicine. But you're delivering it to people that don't have to travel forever to get there, who can't afford to spend overnight at some motel with their families, who often need to come along. So I'm very happy about that. Back in 2007, as the President said, former FCC Chairman Kevin Martin joined me in West Virginia to announce this exciting $8.4 million federal grant for this project, which was really the benchmark for all of the development which has taken place since. And I have to say that I'm chairman of the Commerce Committee, which does science and technology, as well as transportation and aviation, space, oceans, all kinds of things. But the FCC is within our jurisdiction. And that's a very important close relationship because FCC equals telecommunications. They do it. They pay for it. They encourage it. Hopefully we fund it. Under the new Congress, we're a little less generous in our funding, but we fund it as much as we possibly can. And I'm very proud of that work. So that's number one. Number two is the Metro Fiber Building project announcement, which the President talked about and had a very good map on. The second announcement, therefore, is we're able to celebrate the completion of the first project in West Virginia under the Rural Health Care Pilot Project, right here in Huntington. This initiative is paving the way for improved, very high-speed internet access connecting hospitals and rural clinics in West Virginia, and it will soon be available throughout the state. Now, at this point, I have to say, and I recognize my speech is getting on a bit, but I don't care because I'm enjoying it. And that is that in the much-beloved health care bill, which is much beloved by me, it needs some improvement, but I care about it, there is a ton of money in that, but also in the stimulus program. The often attacked stimulus program. There was a whole lot of money for broadband, the expansion of broadband. I mean, money just doesn't float out of nowhere. It has to come from somewhere. It has to be legislated when it comes down to this point. So there's a lot of emphasis in the health care bill on health IT, and therefore getting rid of all the paperwork and getting rid of all the things that will drive all of you, or are driving all of you, or have already driven all of you crazy. And we want to get rid of that to make it more efficient, not just for you, but also for the patient. So this project will provide advanced high-speed internet among Marshall University, Marshall's Joan C. Edwards School of Medicine, in which I believe I am standing, St. Mary's Medical Center, and Cabell Huntington Hospital. It will enable these medical centers to connect to rural health care centers in multi-county, tri-state region, which is as it should be. Now, let me just give an example. When I was a social worker in 1964 and 65, I was in half in Boone County and half in Kanawha County, and nobody had any health care. There had never been a doctor who had ever been to that community. People were scared of doctors. People were scared of health care. I remember taking a kid once to a job interview, and he had to cross a street which had a red light. He'd never seen a red light before. Red light, green light, easy for us, hard for him. Had an effect psychologically. So then he had to take an elevator. Never taken an elevator before. This is not uncommon. If not, it's just in West Virginia and all over the country, in rural places. So by the time he got up to take his job interview, he was a dismantled person. He had lost his self-confidence. And then the person interviewing him from Carbide, as it turned out, who was a very nice man, the sun was shining right in this guy's face from my 18-year-old friend's face. And so the Carbide guy said, "Let the blinds down, son." Well, guess what? He'd never seen blinds. And these are the things that are important to know about why not making people come to a hospital and having the hospital come to them when they need them is so important. He had to manipulate ropes on either side. He couldn't do it. He ended up hanging from the slats, and failed the interview, and was deeply discouraged as a result of that. But those things just drive you forward. They drive you ahead for solutions to make it easier for a person not just to get a job, which we'll be discussing at the Dow Center after this event, but also obviously in healthcare. So I am really proud, and I remember too that when somebody had a problem in healthcare in West Virginia, where did we go? Where did we go? If they would tell me about it, we would go to the Lincoln County Rural Health Center, where Dr. Bob Marshall Walker was still in charge. See, but I'm loyal at least. I think he still goes there. And this was some 45 years ago. But you see, it wasn't a hospital. It was just on the ground level. It was like an old Kroger store. So people were comfortable. They felt comfortable. They knew Lincoln County. They had relatives over there. They felt comfortable going into this rural health clinic. So rural health clinics are not second rate. They're only second rate if they're not connected to all of the knowledge and information which is stored within other hospitals and which technology then makes available to them. So I totally believe in this. I totally believe in this project. I think it's going to make West Virginia better. It's going to make West Virginia people healthier. It's going to get people to overcome their fear of health care. It's going to take away from the frustration of doctors and nurses and others who want to be able to talk with these people and to help them. It's going to help baby care. It's going to help a lot on prevention. It's going to help a lot on mental health conversations. Mental health conversations. That's got to come out of, that's got to be just a part of American discussion of healthcare, mental health. It's no longer something you don't talk about. It's something you do talk about. And this specifically can help that. And they don't have to, they just have to go over to the Lincoln County Health Center, and then they can get all of that help. They get all of that help. And you say, well, you don't want to do the psychiatric examination out in the public, so they go to a little private room where they're set up through video and voice back and forth to be able to handle this. So I am, President Kopp, very, very excited about this announcement and about the direction of what's happening. And broadband was originally funneled and fueled, energized by the idea of getting faster phone service out to people. That was the original part of it. And then all of a sudden we discovered there was a whole nother level, which was called healthcare. And we could deliver healthcare and develop really good relations with people who just didn't have the time or the money or the courage to come in and admit themselves to a hospital or whatever. So, healthcare is worth fighting for in every single way. Every single way. And it's a huge expense. It can be a much less expensive expense if we do the right things, and this is a part of it. So put me down as excited, proud, and happy. And otherwise, it's just a normal day.
Senator, we're going to activate
Yeah,
this.
is this it?
We're going to press that in a moment.
See, I think this is very interesting. The president, in my briefing, it says that the president was going to have a computer, and that the president was sort of guide my finger to the proper button to turn on this activate fibers and all kinds of things. But he's made it a little easier.
We have an easy button.
Yeah.
And it's a Marshall easy button. Now, for all the folks assembled here, you need to understand that when we light the fiber, it's lit with green light in this part of the state. So, Senator,
Together?
together, let's light the fiber. There it is.
Oh, did that just come on? Good.
Thank you so much. It's always a pleasure to have you.
Well, I love
I
talking.
wanted to share this with you. This is something to remember today, bud.
Good.
Thank you for everything you
It's
do.
heavy.
I'd like to thank everyone who joined us today. We have interviews up here for the media if they'd like to. We have a reception outside briefly. And thank you all. This is a milestone, historic day, not only for Marshall, but for the entire community in this state of West Virginia. Thank you all for joining us.